In this case, we present the nuances of endovascular mechanical thrombectomy in a patient with a right middle cerebral artery occlusion using the novel device EmboTrap. The patient is a 64-year-old female who presented to the emergency room with acute left upper lower extremity weakness. On examination, she was awake, oriented to person only, with a slurred speech and left facial palsy. Her initial NIH score was 11. She has past medical history of high blood pressure, mechanical aortic valve, chronic heart failure, COPD. Patient was on aspirin and Coumadin, but she was not very compliant to her medications. CT angiography demonstrated acute occlusion of the right middle cerebral artery, proximal M1 segment. CT perfusion demonstrated preserved volume. However, she had significant penumbra on the right MCA territory. The patient was taken emergently for mechanical thrombectomy. Under conscious sedation, we obtain access into the right femoral artery using a 8-French sheet, and using a balloon guide catheter, we navigate into the right common carotid artery and right internal carotid artery. Once we have the guide catheter in the internal carotid artery, cranial runs demonstrate complete occlusion of the right middle cerebral artery, and on the roadmap we navigate the microwire, microcatheter, and reperfusion catheter. In this case, it's a Sophia 6 French or Sophia Plus. We advance both the microcatheter and the reperfusion catheter approximately at the cavernous segment of the internal carotid artery. Then with a microwire on a J shape, we cross the thrombus, perform a micro injection to demonstrate that we have adequately crossed the entire length of the thrombus, remove the microwire and exchange for the stent retriever. In this case, we have the novel device EmboTrap. We start deploying. As you can see here, the stent has been deployed completely. We also simultaneously advance the Sophia 6 reperfusion catheter. You can see clearly the device very well open, and then simultaneously we inflate the balloon guide catheter to achieve flow arrest, and simultaneously we advance the reperfusion catheter, and this is probably the most important part of the procedure. We really have to advance the reperfusion catheter into the stent retriever doing the Solumbra technique, and then under flow arrest we remove simultaneously catheter and stent retriever, obtaining complete reperfusion of the middle cerebral artery, as you can observe in this angiography. And here you can see the thrombus that was removed from the middle cerebral artery. Thank you.